Hello, my name's Kanan. I'm a consultant anaesthetist in Sydney. I'm here speaking to Associate Professor Sibs Anwar after he gave a brilliant talk at our second session for the ASM today. Thank you very much for speaking to me, and thank you for an excellent session this morning. A couple of questions. So I was doing some research last night and noticed that you have multiple fellowships overseas. I was just wondering, how on earth do you split your time? How do you find time for doing everything? And what does a week for you roughly look like?
So I'm an anaesthetist by trade, but I do intensive care and pain medicine. So that training took a long time, and as a result, I run the pain service. So I do pain rounds. I do a theatre list. I occasionally get imposter syndrome over whether I do enough theatre. So I do a cardiac list, but only one with one surgeon.
Yeah.
So we're very good friends. I don't really know what happens in the other theatres, but half my time is research, clinical research around pain. I have a collaboration with a scientist. We look at the mechanisms from acute to chronic pain after surgery, which is my research interest, and we do clinical trials. So it's sort of a 50-50 job, but it's a work in progress, and it changes every year.
Yeah, sounds like a 7-day week.
It does.
Now, I really appreciated in your talk how you mentioned your pre-op pain clinic. Given that you guys do a lot of cardiothoracic work overseas at your institution, and that there's such a high post-operative pain rate, in especially the thoracic surgery. How long did it take for you guys to set up your preoperative pain clinic and that kind of follow-up pathway? So I think that's an excellent idea and something that,
It's a fantastic question because actually it's a work in progress. We're still doing it. Hans Clark, who I name dropped in the middle of that presentation, has been a great supporter. He's done this in the general population. Cardiothoracic is niche. And it's a completely different challenge, but we spent about a couple of years doing that. It's still happening. I mean, the service is live now. We've treated, almost 100 patients, but it's not finished. And I think it's an iterative process. I talked a little bit about the principles of health economics and the principles of evaluation. So I think it's going to be, by the time it's finished, it's going to be unrecognizable from where it is at the moment.
Yeah.
So it's, it's a journey.
Yeah, great. Now, one of my last questions, has there been any evidence that you've seen about surgically placed pain catheters compared to anaesthetist or anesthesiologist placed pain catheters?
Yeah, it's an interesting one because we're sort of talking about preemptive analgesia versus post-operative. So the surgeons place the catheters once they've done their lung resection, so it's essentially a late block. Colleagues have tried to look at the timing of preoperative injection versus post-op, and the evidence is murky. It's essentially equivocal. Bristol trial showed no difference at all with placebo injections. A colleague, my mentor, the lady who taught me thoracic anesthesia, Cheng Ong, is doing a trial at the moment of preoperative anesthetic ultrasound-guided paravertebral versus early and late. So that is something that will come out in the wash in due course, but the jury's out.
Yeah,
and it's difficult, isn't it? Because most of us would expect preoperative or preemptive analgesia to be more superior, but the evidence is not really there.
Yeah, okay, well, we'll keep watching.
Yeah, absolutely.
And finally, I'm hoping this is a bit of a holiday for you. What have you got planned for the next couple of days? What's on top of your sightseeing list?
So I'm very lucky that 4, 5, 6 colleagues that I've worked with at Barts, who've trained with us at Barts, are here as consultants. So they're showing me a good time. I've already been out last night for dinner, and I'm sure that will continue. So there's going to be lots of Sydney side fun, I'm sure.
Perfect. Excellent. All right. Well, thank you very much for speaking to me, and thanks again
Kanan.
for being here today. I really appreciate it.
Cheers.
Thank
Pleasure.
you. Thanks.